Children's Wisconsin is a Level 1 pediatric trauma center. As pediatric ICU fellows, we attend all Level 1 and 2 traumas when on call. Usually the fellow on West 4 takes trauma call. However, if there is only one fellow on between West 4 and West 5 overnight, then they cover both trauma and codes. When arriving to the trauma bay, we are responsible for the role of doc left. As doc left, we perform the primary survey, airway, breathing, and circulation. Additionally, we may be asked to run the code if the trauma were to turn into a code situation. The trauma bay is a great time to experience working with a multidisciplinary team, including anesthesia, emergency medicine, and general surgery.
We have a pretty large simulation center located in the Children's Corporate Building. We use mannequins of all sizes, which are connected to high-fidelity simulation software and controlled from a separate control room. The simulation rooms have equipment similar to an ICU patient's room, including airway devices, access, procedures, and medications. We participate in critical care simulations led by our faculty and trauma simulations, which includes the full multidisciplinary team. We also have the opportunity to run simulations and mock codes for pediatric residents and other trainees.
During your 3 years of fellowship, you will gain invaluable experience as medical control while carrying the 3939 pager and being an active member of our own pediatric transport team. As the fellow carrying the 3939 pager, you will be responsible for taking calls with direct and indirect supervision from attending staff for admissions to the PICU from RED, as well as calls from hospitals in the surrounding areas of Wisconsin, Michigan, and Northern Illinois, looking to transfer patients to our facility for higher level of care. Our transport team is comprised of a registered nurse and respiratory therapist with pediatric critical care training. As the first-year fellow, you will rotate for 2 weeks with our transport team by ground to become familiarized with the team, their protocols, and the ambulance. During your second and third year, you will have twice-monthly shifts as a transport provider when needed for critically ill patients. These transports may be via ambulance, helicopter, or fixed wing, depending on the clinical situation and weather. There are also opportunities for moonlighting with the transport team while complying with duty hours in your second and third year.
Team rooms here are where you spend most of your workday. You receive sign out here at 7 a.m. and following sign out, you prepare for rounds that start shortly following 8 a.m. As you can see here, there are plenty of computers where the residents, nurse practitioners, and fellows all share the same workroom. On the board, you will see a list of the two teams and the patients that are split up between the two teams, either the nurse practitioner team or the fellow team. They will be color coordinated, and each one will have listed the resident or nurse practitioner that is caring for that patient. The boards are the same on all 3 floors, West 3, West 4, and West 5, and usually new admissions will be written up here as well. Thank you everyone for taking our virtual tour. Please let us know with the emails listed here if you have anything else that you would like to see that we might not have covered, and we'll be able to make a video and send it your way. Thank you so much and good luck.